Thank you, Dr. Thorpe. For the public that's watching and those of you who are in the audience, we did extend invitations to the Guam Board of Medical Examiners, the Guam Memorial Hospital Authority, as well as the Guam Behavioral Health and Wellness Center to provide testimony. And as the start of this hearing, we did not receive any on Bill 206. We did receive testimony from David Lubofsky. We were expecting him to come in on Zoom, but he is not able to. He did request that we read his testimony into the record. So, do you want me to read it? And Senator Telo, I will read it into the record. Hafa, Madam Chair and Honorable Senators, thank you for allowing me to give testimony. My name is David Lubofsky. I'm here to support Bill 20638 with urgency to save lives. Guam's healthcare system is not just strained, it is failing our people for many reasons, but most obviously because attempts to modernize our medical licensure laws and bring qualified foreign-trained physicians to Guam has been blocked for years by the same group of individuals who have also fought to weaken medical negligence accountability. That is not a coincidence. That is a pattern. In the 34th Guam Legislature, Senator Dennis Rodriguez Jr. introduced Bill 12534 and Bill 12634, both designed to expand access to qualified foreign-trained physicians. These bills would have addressed shortages and aligned Guam with the rest of the United States. And what happened? They were met with fierce resistance. One doctor even said publicly in the Guam Daily Post, quote, "If they are going to let foreign doctors practice here on Guam, then will I be able to practice in the Philippines or in Japan," end quote. That was the argument, not safety, not standards, not the needs of the people of Guam, not the needs of GMH. He focused on reciprocity, competition, turf, and self-interests over the interests of the people of Guam and ignoring the largest maternity death rate in the country. And speaking of turf, it is really a coincidence that Guam has the least malpractice accountability in the country, which even allows doctors to work outside of their fields and earn more on procedures they otherwise would not be able to do, while at the same time, Guam has no functioning Conrad 30 program pathway to bring foreign doctors to the island. This is not a coincidence. This is a system designed to keep competition out and keep accountability down. We see the consequences every day. GMH is understaffed, clinics are overwhelmed, mothers cannot find OB/GYNs, and families are forced to fly off island for care if they can afford it, but most cannot. Before I go further, I want to say this clearly. Guam has great doctors. I have one of the smartest and most caring family doctors in my life. My eye doctor is outstanding. My dentist is excellent. But we do not have enough specialists. That is why I'm sitting here today in the Philippines receiving specialist follow-up care that rivals anything at Queens MC in Hawaii, Good Samaritan, or Cedars-Sinai in Los Angeles. Hospitals where I have personal and family experiences myself. I know the level of care they provide because I have lived it. And I can tell you, the specialists and doctors at St. Luke's or other facilities are every bit as capable. With the passage of Bill 20638, the poorest and most disadvantaged patients on Guam will finally be able to access life-saving care right on island, similarly to what we get in the Philippines or the States. Bill 20638 modernizes our licensure law so that foreign medical graduates who meet rigorous, verifiable standards can practice on Guam. From what I understand, all 50 states operate a Conrad 30 program. Guam is one of the only jurisdictions that has never fully implemented this proven federal tool. Bill 20638 finally gives Guam a functioning Conrad 30 program. It will save lives. The Guam Board of Medical Examiners knows the system is broken. They know the shortages are dangerous, but without legislative authority, they cannot act. Bill 20638 gives them that authority and removes the excuses that have protected the status quo for far too long. Bill 20638 will also help to reduce concerns about medical negligence or medical apathy that has taken the lives of our children and loved ones. When you increase the number of qualified providers, you increase competition, and competition always improves the quality of care. This also lessens the need for providers to work outside of their area of expertise due to a lack of a doctor in the needed area. This bill is not about politics. It is not about protecting turf. It is about the people of Guam who have waited for far too long for a functioning healthcare system. It is about mothers who cannot find an OBGYN, and families who cannot get timely care. It is about a hospital that has been stretched to the breaking point. Bill 20638 is a prescription for justice. It is long overdue. I urge you to pass this bill without delay. Sizu Ismaasi, David Lubofsky, ED.D. We will now open the floor for questions, and we will begin with the author, Senator Taitague.
Thank you, Madam Chair. Madam Chair, I could go last and also do my closing. I'll allow my colleagues to ask questions. Thank you.
Senator Borja.